Did you know that 70% of kidney damage can go unnoticed until it's really serious? Our kidneys play a huge role in filtering waste, balancing fluids, and controlling blood pressure. But often we don't notice when they're struggling. The signs of kidney problems can be very subtle and are sometimes confused with other health issues. Since the kidneys are so good at adapting, you might not feel anything is wrong until there's a lot of damage. So it's important to pay attention to your body and catch any weird signs early. Stay tuned as we go through the top 10 strange but important signs that your kidneys might be in trouble and why it's crucial to notice them before it's too late. But before we begin, I'm curious about you. Where are you watching from? Let me know in the comments and feel free to ask any questions you might have. Now let's begin. Number 1, changes in urine color and odor. Let's start with something you probably deal with every day, urination. It's not a topic that typically comes up in casual conversation, but your urine can tell you a lot about your kidney health. Kidney damage can lead to some pretty noticeable changes in the way your urine looks, feels, and even smells. When your kidneys aren't functioning as they should, you might notice that your urine becomes darker or even has a reddish tint. This could be a sign of blood in the urine, a condition called hematuria. If the color is more brownish, it might indicate that your kidneys are having trouble filtering out waste products properly. You could also notice foamy or bubbly urine, which is a sign that your kidneys are leaking proteins into the urine, a condition called proteinuria. But wait, it gets weirder. Kidney damage can also cause your urine to have an unusually strong or foul odor. This happens because the kidneys are struggling to filter waste from your blood, and some of these toxins end up in your urine. If you've noticed a change in the smell that doesn't go away even after drinking water, it's worth checking in with your doctor. What's important here is that you should never ignore changes in your urine. These can be some of the earliest warning signs of kidney damage even before you feel other symptoms. If you're noticing any odd color, smell, or texture in your urine, it's time to pay attention. Number 2, swelling in your feet, ankles, or hands. Swelling in your feet, ankles, or hands might seem like something that happens after a long day of standing, but if it becomes persistent or unexplained, it could be a sign of kidney damage. The kidneys are responsible for regulating fluid levels in your body, and when they aren't functioning properly, fluid can start building up. When your kidneys are damaged, they lose their ability to filter excess fluid, leading to water retention. This swelling, also known as edema, can occur in your lower extremities, like your feet and ankles, because gravity tends to pull fluid downwards. However, swelling can also appear in your hands, face, or abdomen, depending on how severe the kidney damage is. Now, this isn't just about looking a little puffy. Swelling from kidney issues can feel heavy and uncomfortable, and in severe cases, it can lead to other complications like difficulty breathing or high blood pressure. If you notice that your shoes don't fit like they used to, or your rings are tight around your fingers, you might want to get your kidneys checked out. It's essential to remember that while swelling can be caused by several things, like sitting too long, eating too much salty food, or even pregnancy, persistent or unexplained swelling is definitely worth investigating further. Kidney-related swelling is one of those subtle signs that often gets overlooked, but it's an important signal your body is sending. Number 3, fatigue and unexplained weakness. We all feel tired from time to time, but have you ever felt weirdly exhausted for no apparent reason? If you're constantly feeling drained, weak, or like you're running on empty, it could be more than just a late night or a busy schedule. Fatigue is a very common sign of kidney damage, and it often catches people by surprise. So, what's going on here? Your kidneys play a key role in producing erythropoietin, a hormone that signals your bone marrow to make red blood cells. Red blood cells are responsible for carrying oxygen throughout your body. When the kidneys are damaged, they produce less erythropoietin, leading to fewer red blood cells and less oxygen getting to your muscles and organs. This results in extreme tiredness and weakness. At first, you might chalk up your fatigue to stress, sleep, or other factors. However, if you find that no amount of rest seems to fix the tiredness and it's affecting your ability to get through your day, it could be a sign that something bigger is going on. And when combined with other symptoms like swelling or changes in urine, the dots might begin to connect. Don't ignore prolonged fatigue, especially if it's affecting your daily life. If you're feeling like you just can't keep up with your usual activities, it might be time to talk to your healthcare provider about your kidney health. Number 4, persistent itching and skin rashes. If you've ever experienced persistent itching for no clear reason, you know how frustrating and uncomfortable it can be. But did you know that itchy skin could be related to kidney problems? It's one of those weird signs that people often don't connect to kidney damage. When your kidneys aren't working properly, toxins start to build up in your bloodstream because the kidneys are no longer able to filter them out effectively. This buildup of waste can irritate your skin, leading to itching or rashes. The more waste that builds up in your body, the worse the itching becomes. It's commonly referred to as uremic pruritus. This type of itching is not just a random annoyance. It can be intense and chronic, especially on the back, arms, or legs. It may worsen at night and be accompanied by a rash or dry, scaly patches. If you've tried all sorts of creams and remedies and still can't get relief, your kidneys could be trying to tell you something. Another important thing to note is that if kidney damage progresses, this itching can become a more severe problem. It can lead to sleepless nights, skin damage from scratching, and an overall decrease in quality of life. So if you've been struggling with persistent skin issues that don't seem to have a clear cause, it's time to consider the possibility of kidney damage. Number 5, shortness of breath, even with minimal activity. If you find yourself feeling winded after climbing a few stairs or walking around the block, it might be time to pay attention to what your body is telling you. Shortness of breath is often linked to heart problems, but it can also be a sign of kidney damage. How do the kidneys contribute to this issue? Let's break it down. When your kidneys are functioning properly, they help regulate the balance of fluids in your body, and they also produce a hormone called erythropoietin, which stimulates the production of red blood cells. Red blood cells are the ones responsible for carrying oxygen throughout your body, including to your muscles and organs. When your kidneys are damaged, they can't produce enough erythropoietin, leading to fewer red blood cells in circulation. The result? Less oxygen is delivered to your body, making it harder for you to breathe, especially during physical activity. This shortness of breath can come on gradually, which is why many people don't notice it right away. You may feel like you're getting out of breath a little quicker than usual, or you might have to pause more often during tasks that require mild physical exertion, like walking or carrying groceries. It can also be exacerbated by swelling in the lungs, another complication of kidney damage. What's even more concerning is that this shortness of breath can sometimes be paired with a feeling of fatigue or dizziness, making it even harder to carry on with everyday activities. If this sounds familiar, it's a good idea to speak with your doctor. Kidney damage-related shortness of breath may not improve with rest, and it's a clear sign that something isn't quite right with your kidneys. In the early stages, this might be mistaken for simple tiredness or being out of shape. However, if you notice that your breathing becomes increasingly labored or if it's interfering with your usual routine, don't ignore it. Catching kidney problems early on can make a huge difference in treatment and management. Number 6, bad breath, also known as uremic foul breath. We've all had that experience where we wake up with morning breath or have a less than pleasant breath after eating certain foods, like garlic or onions. However, there's a much more concerning type of bad breath that can signal kidney problems, and it's often called uremic foul breath. It's a strange and often unpleasant symptom of kidney damage, and you might find it hard to pinpoint at first. So why does kidney damage cause bad breath in the first place? It all boils down to the kidney's role in filtering out waste from your blood. When your kidneys aren't working properly, they aren't able to effectively remove toxins and waste products like urea from your bloodstream. As a result, these waste products build up in your body. When urea breaks down, it produces ammonia, one of the key culprits behind the bad breath associated with kidney damage. This breath isn't just a little off, it has a distinct odor that is often described as ammonia-like or even similar to urine. It's much stronger than the usual bad breath you get from food or poor dental hygiene, and it's not something that brushing your teeth will fix. The only real way to get rid of it is to address the underlying kidney issues causing the buildup of waste. What makes this symptom even more alarming is that it's usually a sign of advanced kidney damage, as it takes a considerable amount of time for toxins to build up to the point where it's noticeable in your breath. So if you're experiencing this type of bad breath that doesn't go away with regular oral care, it's important to consult a healthcare professional immediately. Sometimes the presence of uremic foul breath can be accompanied by other symptoms of kidney damage, like changes in urine, swelling, or fatigue. So if you notice that your breath has this unique, persistent odor and it's not linked to any dietary habits or mouth issues, it's a good idea to bring it up with your doctor. Number 7, loss of appetite and nausea. It's normal to occasionally lose your appetite, especially if you're stressed or have a minor stomach bug. However, if you're dealing with persistent loss of appetite and feel nauseous regularly without any apparent cause, it could be another clue that your kidneys are in trouble. When your kidneys are damaged, they aren't able to filter waste products from the blood as effectively as they should. This leads to an accumulation of toxins in the bloodstream, which can directly affect your digestive system. Your body may react to this buildup of toxins by causing feelings of nausea, stomach discomfort, or even vomiting. The loss of appetite that comes with kidney damage often feels like a gradual decrease in your desire to eat. You may not feel like eating your usual meals, or even your favorite foods might seem unappetizing. In some cases, kidney damage can make food taste metallic or cause a general feeling of unease in your stomach. Over time, this can lead to weight loss and malnutrition, which only worsens your overall health. It's important to recognize that nausea and loss of appetite related to kidney damage aren't just isolated symptoms. They often occur alongside other signs like fatigue, swelling, and changes in urine. As your kidneys fail to do their job, the accumulation of waste products starts affecting multiple systems in your body. This can result in a series of interconnected symptoms that may seem unrelated at first, but together they tell the story of kidney damage. If you're experiencing prolonged nausea, vomiting, or loss of appetite, especially if you can't seem to pinpoint a cause, it's essential to seek medical attention. These symptoms can lead to dehydration and further complications, so addressing them early can make a big difference in your recovery. Your doctor will likely perform tests to check your kidney function and determine the best course of treatment. Number 8, frequent urination, especially at night. We all know that drinking a lot of water leads to more trips to the bathroom, but what happens when your kidneys start failing? One strange and frustrating sign of kidney damage is the need to urinate more frequently than usual, especially during the night. This condition is known as nocturia, and it can disrupt your sleep and cause a lot of inconvenience. Nocturia, or waking up several times throughout the night to urinate, is not a typical sign of aging. It's actually one of the earliest signs that something could be wrong with your kidneys. When your kidneys are in trouble, they may have difficulty concentrating urine, causing your body to produce more urine even when you're not drinking excessive amounts of fluids. This leads to the frequent need to urinate, especially at night when your body is supposed to be resting and not producing as much urine. In addition to nocturia, you might also notice other changes in your urination, such as the amount of urine you're passing or its color. It may appear darker, foamy, or even bloody, all of which can indicate kidney damage. If you're making multiple trips to the bathroom at night and your sleep is being disturbed, along with experiencing other symptoms such as fatigue or swelling, it's important to get checked out by a healthcare provider. Frequent urination, especially at night, can affect your overall quality of life. It can leave you feeling tired, irritable, and disrupted in your daily routine. The good news is that when kidney problems are caught early, they can often be treated or managed effectively. So if you find yourself waking up several times a night to use the bathroom, don't ignore it. Consult your doctor and ask for a kidney function test to rule out any underlying issues. Number 9, high blood pressure. We all know that high blood pressure is a major risk factor for heart disease and stroke, but did you know that it can also be a sign of kidney damage? In fact, high blood pressure is both a cause and a consequence of kidney issues. If you've been dealing with consistently high blood pressure, especially if it's been difficult to control, your kidneys might be trying to tell you something. So, how does kidney damage lead to high blood pressure? It all comes down to the kidney's role in regulating the body's fluid balance and blood pressure. Healthy kidneys filter out excess fluid, waste, and salt from your bloodstream. When the kidneys aren't working properly, they can't remove enough of these substances, leading to a buildup of fluid in your body. This extra fluid increases the pressure within your blood vessels, resulting in high blood pressure, also known as hypertension. But the connection between kidney damage and high blood pressure goes beyond just fluid retention. The kidneys also produce hormones like renin, which helps control blood pressure. When the kidneys are damaged, they may release too much renin, causing your blood pressure to spike even further. Now, you might wonder why high blood pressure is such a big deal when it comes to kidney function. Well, the constant strain of high blood pressure can actually damage the blood vessels in the kidneys over time, making it even harder for them to filter out waste and maintain fluid balance. This creates a vicious cycle. High blood pressure harms the kidneys, and the kidneys, in turn, contribute to even higher blood pressure. If you've noticed that your blood pressure readings are higher than usual, or if you're struggling to keep it within a healthy range, it's important to consider kidney function as a possible factor. While high blood pressure can also be caused by stress, poor diet, or other health conditions, kidney-related hypertension is something that should not be ignored. So what can you do if you suspect that high blood pressure might be related to kidney damage? First and foremost, it's crucial to get your kidney function checked by a healthcare professional. If kidney damage is the cause, early intervention can help prevent further harm. Managing your blood pressure through medications, lifestyle changes, and a kidney-friendly diet can make a significant difference. Ultimately, high blood pressure might seem like just another common health issue, but when it's linked to kidney damage, it becomes a red flag that needs immediate attention. Stay on top of your blood pressure and take action before it spirals into more serious kidney problems. Number 10, chest pain, more than just a heart issue. Chest pain is often associated with heart problems, and for good reason. It's a common symptom of heart attacks, angina, and other cardiovascular conditions. But did you know that chest pain can also be a sign of kidney issues? It's a less commonly recognized symptom, but it's one that shouldn't be overlooked, especially if you have other signs of kidney damage. The connection between chest pain and kidney damage might not seem obvious at first, but it's actually related to the way kidney dysfunction can affect the fluid balance in your body. When your kidneys aren't working properly, they struggle to filter out excess fluid and waste. This fluid buildup can lead to increased pressure on your blood vessels and heart, and in some cases, it can cause fluid to accumulate in the lungs, a condition called pulmonary edema. Pulmonary edema occurs when excess fluid in the lungs makes it difficult to breathe, and it can cause chest pain or discomfort, especially when you're lying down or exerting yourself. The sensation of chest pain in this case is often described as a tightness or pressure in the chest, and it may be accompanied by shortness of breath or a feeling of suffocation. Another way kidney damage can cause chest pain is through its impact on blood pressure. As we discussed earlier, kidney dysfunction often leads to high blood pressure, which can put additional strain on the heart and blood vessels. This increased strain can contribute to chest pain, especially if the blood pressure becomes dangerously high. So how do you know whether your chest pain is related to kidney damage or something more serious like a heart attack? It's not always easy to tell, but the key is to pay attention to the full range of symptoms you're experiencing. If you have a history of kidney problems, high blood pressure, or fluid retention, chest pain could be related to those issues. However, if the chest pain comes on suddenly and is accompanied by other classic signs of a heart attack, like arm pain, nausea, or dizziness, it's essential to seek emergency medical attention right away. If you're dealing with persistent or unexplained chest pain, especially in combination with other kidney-related symptoms, it's critical to consult a doctor. They will likely perform tests to evaluate your heart and kidney function and help you determine the underlying cause of the pain. Early detection and treatment of kidney problems can reduce the risk of complications, including heart failure and other serious conditions. Thanks for watching. Now that you know some of the weird signs your kidneys might be in trouble, it's important to keep an eye on your health and listen to your body. If you notice any of these symptoms, don't wait. Talk to a healthcare professional. Stay healthy, take care of your kidneys, and remember, prevention is always better than cure. Don't forget to like, subscribe, and hit the bell icon for more health tips. See you in the next video.